I always really liked the idea of old school medicine. So when I was growing up, I watched a lot of House, and I always liked the idea of being able to go into a room, talk to a patient, lay hands on them, and give a diagnosis and give a treatment plan. And neurology has always been a field in which the physical exam is still king. It's a field in which it's very important to see a lot of different people, to learn their habits, to watch the way they move, they talk, and that's how we make our diagnosis. Hi, my name is Dr. Yiwen Shi, and I am a movement disorders neurologist at Cooper and Inspira Neuroscience. When I first meet a patient, I ask about what is their chief symptom. So what symptom bothers them the most? Sometimes it's tremor, sometimes it's problems walking, sometimes it's something that almost seems unrelated, things like anxiety or constipation that actually play into the full picture. And then as I speak to them, I learn how much these symptoms bother you. I learn about their family history, what things they do or do not do because of these symptoms. Like some people like to play golf, they have a bit of tremor, and it makes it much harder for them. I watch them walk, I watch them move their hands, we do a full exam. And then in the end, I sort of suggest, this is what I think this is the potential diagnosis, and I tailor my treatment according to the questions I've asked the patient. I think that it's really important to individually tailor therapy and to sort of take into account the patient's own preferences. I think there's been a lot of research in neuroscience in both the diagnostic and the therapeutic elements. So in terms of diagnosis, we can diagnose diseases much earlier now because of new imaging or blood marker findings that can support just early features. In terms of therapies, I think there's a lot of advancements of both medical and surgical treatments, just ways to just be more accurate, to minimize side effects, and give patients a better quality of life. I would like to hope my patients would say that they feel safe with me, that I listen to them, that I address their concerns to the best of my ability, that I gave them all the information they needed, that I supported them throughout their journey over the years. Because when we see our patients, we learn a lot about them. We learn about their hobbies, their interests, their families. There's a very strong relationship that's built over time with the kind of patients that I see. And it is a journey, and there is going to be pitfalls and hard times. And I hope that they would say that, my doctor was there for me.